Hey guys, welcome to another episode of Fredrickson Health Solutions. Today we're going to talk about depression and anxiety. It's been said that 17.3 million Americans are suffering from depression or have had a major depressive disorder in the past year. Today we're going to talk about some natural solutions and some remedies for people that have been treatment resistant to depression. Today I have my very good friend Tom Schnorr, pharmacist here at Austin Compounding Pharmacy, also a clinical nutritionist. And is there anything else we should have? But he's going to be talking about his treatments, his natural remedies, and what he's seen in his clinical practice in pharmacy here in Austin, Texas. So, Tom, thanks for coming on.
Thank you. Thanks, Robert. Thanks for being patient with my morning. COVID does keep us on a busy schedule, so thank you. Oh my God, there's a drug that's been out since the early 60s. Was used by the military. Oh, we'll hold this high. We'll hold this. Used by the military in the 60s during the Vietnam War, was recreationally used for a long time before the MDMA and ecstasy showed up in the 80s, and cocaine lost its favor and only was being used in veterinary medicine and emergency rooms. The item is called ketamine. It has spiked a large interest across the nation because practitioners have finally realized that we've got great data showing how it can help with depression. Right now, as Robert said, we have a large percent of our populations normally with a high amount of stress and depression. It's even higher now. We have COVID out there, even higher now that we have people out of work, even higher now we have the protests going on. When things were normalized back last fall, we were reporting some 250,000 suicides a year here in America.
Say that again?
250,000 suicides, untreated. They didn't seek help.
Whoa.
Then I don't know what the number is for those who sought help that year and still committed suicide. The drugs we've been using for depression are pretty much in the SSRI family, the Prozac, Wellbutrin, Celexa. And for me, since the 80s when those drugs came out, I just watched them be a wet blanket. They took away joy. They took away the smell of the roses. They never have been tested past 6 weeks. However, we've got patients on them for 6 years. They get into a funk. A family member dies. Their damn dog dies. I saw a lot of this during the AIDS epidemic in the 80s and 90s. A family member, partner, will get put on it and never leave them, just keep getting it escalated. As a nutritionist, I would go see them and talk to them about adding B12, adding folic acid, adding fish oils at high doses, even throwing in a little bit of 5-HTP or L-tryptophan to help provide more substrate for the calm. Now, fast forward 30 years, we've got a lot more data on safety of commingling that, even though they black box it from the feds. The serotonin syndrome is a very, very low risk. And yes, it can cause you to swell up for about 2 minutes and you have to fight your way to breathe. And it's best, when that happens. That usually happens on the first or the third dose. So I always tell people do micro amount when they're first trying a 5-HTP while they're on an SSRI. But my real joy would be to get you off the SSRI totally, completely. All the way off. Just wipe it out of your dance card. Use nutritionals, and then see a practitioner to do a few ketamine infusions or ketamine IM injections, or even oral, nasal, rectal. There's a number of practitioners that do in-office treatments, and a number of folks who, after you've done one or two in office, they give you a prescription to take home and do it at home in a better environment. Ketamine, tons and tons of data. There is a stigma against it in the public because it's a rave drug. Well,
Street drug, right?
Yeah, street drug. Yeah, it's a rave drug, and people are using it. But so's alcohol, so's the oxycodone, so's all the drugs. Any and every drug can be used and appropriate. But when used right, this is setting a new era. Today, I have a little over 400 patients using ketamine at home. The number of ones that have abused it have been 3 over the last 3 years. 3 patients I had to restrict access, give them a week's supply, and tell them, if you use it all up in one day, well, you have 6 days of uncomfortable. There's great stuff on using ketamine. One is you only use it 2-3 times a week. After 6 months or so, they'll use it once a week. It is not a daily dose drug like all the SSRIs. This is a 30-minute, 40-minute medication. You have a partial out-of-body experience. Then you come back and kind of the short version is it's whatever was holding you down gets right-sized. Whatever it was that was beating your head down and keeping you in a total funk gets right-sized. And I've seen it across the board. Side effects, almost none. Folks, I warned them they're going to get out of body. They're going to get confused. But that last 30 minutes, I invite them to close their eyes during this. And if they start feeling uncomfortable or nervous, open your eyes for a few seconds, see that you're still in the room you were in, and then close your eyes again. After the medication, that only has a 15-minute half-life.
Wow, that's really fast.
Totally fast. So it's totally out of the body in 45. And you can get in your car and drive about 30 minutes later after that 45. So an hour after doing the medication, you're safe to drive. And
Go back to work.
Go back to work or go home. I tell folks,
Do it at home first, right?
I tell folks, go home, do it at home, safe place, low lights, soft music. It does stimulate your auditory system, so it makes Grateful Dead sound in tune. It makes the birds bright and shiny. And that lasts for a good hour to 2 hours on that part. The out of body part and out of sorts is only 30 minutes. And then I invite them to grab a journal and write, record the event to yourself. Keep a journal of the events. I've seen so many people go back to the therapist and fire them. Say, you know what? My mom did love me. You know what? Yeah, my dog was supposed to die. They're only around for 12, 14 years. And it's okay. I'll check in with them later. And we right-size our trauma. The human body is very funny. When we get hit with trauma, we will disassociate it. We will compartmentalize it. We will put it in another organ or a joint. So we'll put it outside of our brain so we can keep the rest of the system running. And there's a lot of folks who will transfer the trauma into a disease state. They'll get an immune disorder. They'll get cancer. They'll get
from the stress.
From the stress. The stress will take them down.
Right.
We're all talking about COVID, and it's important to keep the immune system up. And stress is one of the biggest removers of lowering your stress. So I don't want to end up in the hospital behind COVID. I don't want to be in that 2% that gets sick or possibly die. I want to just get it and have a cold for 10 days. That's all
Sure.
I want, and I want to do the things that will keep my immune system up. So that's a sidebar we'll talk about. But for the ketamine, it's a very small molecule, very safe molecule. There have been only 12 cases of death or toxicities
Out of how many?
out of thousands and thousands. And these were all street using of people taking 100 times the normal dose. They were taking grams amounts, and they literally shrank their brain and trashed their kidneys.
So that's, as with anything, the dose is the poison,
yes,
right?
Right,
So,
the dosing. We have been using ketamine topically in pain gels, and I would give a patient a 1 ounce, 2 ounce jar, and a little bit works. So they put the whole damn thing on their lower back. Well, the lower back is really close to your kidneys. And we've had 6 cases in the US and 3 in England where it took their kidneys down. Patients were all in their 70s plus, did way too much topically. And for 3 days, they had to just hydrate them, and they recovered 100%. There was no permanent damage to the kidneys. We see a little bit of raising of the enzymes in the liver and kidney activity for people who are chronic high dosing ketamine. And that is one of our early signs to say, hey, it's time we dial this stuff back,
Right.
you've
That's
got,
where we're going to a healthcare
yeah,
practitioner like
yeah.
you or someone else across the
Yeah,
country.
and then our patients on high dose, we like to take a lab every 3 months.
Every 3 months.
But they have to be doing like 300 milligrams to 900 milligrams a couple times a day. These are my rare patients. I have 2 that are high dose, and we check their labs every 6 months, and they've been doing just fine. But they got off 6 large dose antipsychotics, and they're happy. They're living a life again. So the trade-off was phenomenal for them.
Awesome.
Yeah.
Well, let's talk about, these ketamine clinics are popping up all over the country.
All over America.
And so a lot of these are intravenous, correct? And what you're doing here, you don't do the IVs here.
No.
So the doctor will send a prescription,
Yes.
right? And you will advise them, but you also compound. So you can make a compound that's a little bit different than what typically you'll find in other pharmacies. Can you explain that a little bit?
Ketamine is probably best described as it tastes like a Tylenol tablet. If you've ever had the joy of chewing one, you'll never do it again. It is bitter, acrid, and you just can't overcome it for a couple minutes. The nasal spray of ketamine that is out there will burn the back of your nose like spraying Clorox up it. And by the way, don't spray Clorox up your nose for COVID. It doesn't really work, even though our president.
Is that a thing? People saying that?
Yeah. I've been asked.
If you've been asked, that's a problem.
I've literally been asked, should I spray this? What solution? What concentration was the question? And I said zero. Zero concentration. Yes. Bless their hearts. So ketamine is really hard to mask. We've been successful in making it in chocolate mint and making it in a tutti frutti that's almost like a juicy fruit gum. That even at that, we've got patients who says, no, my taste buds can't get past it, even though the medicine works so good.
Sure.
And so we make a rectal suppository for some patients, and the vascular system is so much better and consistent. I've got about 5% of my patients now doing it that method. And they actually ask their doctors call me with what? And I go, yeah, it actually will absorb. It's a small molecule. Today, it's being used a lot in our ERs. It is the first drug of choice to anesthetize a child. Anyone under 12, we're given an IV of that. And when they come back 20, 30 minutes later, they're giving about 10 times the dose we do for therapy. And they anesthetize them. It's a dissociative anesthetizing drug. So it literally, they go out of body. And when they come back, they're talking about being at the park with their friends and riding on unicorns and ponies and petting dogs, and
you sense of euphoria.
Euphoria. Right? They just,
with their best friends.
Yeah.
You have a lot of trust.
Yeah. These children, they don't have the inborn fear that we have if we lose touch with reality. And it's interesting. I was chatting with an ER nurse, and she said, yeah, anybody else 18 and up, they'll give them the ketamine, and they come back fighting 30 minutes later. They're like, what'd you do to me? And she knows if she leans in while she's giving the injection to say, it's okay, we've got you. You're going to lose control of where you are for 30 minutes. Just go with it. You have your own movie in your head. That's how she describes it. And she said, they get that, and they don't come back in rage and anger and scared. She says, so people that, if you're a real control freak, it can be a little scary losing touch.
Control,
yeah,
right.
You're totally giving up control to a small molecule, and it's like, am I going to come back? Am I going to die? And no, this is a medicine that the World Health Organization lists as number 4 of the top 20 drugs that should be available worldwide, because you can anesthetize a person, literally turn off their pain receptors, so you can do field surgery. I mean, that's what we used it for in Vietnam.
Sure. Wow,
it's for field surgery. It is used in Africa, the Saharas. It's used in South America, where they don't have hospitals. They're just doing surgery on a kitchen table. And they give them the ketamine. They don't even have to monitor pulse rate or oxygen saturates. It is a very, very safe medication. And we have been collecting tons and tons of data on doing IV dosing and IM dosing, anywhere from just as little as 2 to as many as 6, coupled with a month to 6 months of an oral dose, and a person walking away from a traumatic PTSD event. We started the first studies on soldiers, and that was over 5 years ago. And
So
PTSD,
yeah,
big
wow,
time.
okay.
It is working. Most insurance companies are not covering it, but not yet. There are a number of psychiatrists around the nation that have figured out how to bill for an extended visit and give the medication at a reduced rate. Prices vary for patients on the IV, as little as $400, as much as $800. Prices for some of my psychiatrist's office have found ways to bill insurance for a long visit, do a therapy, and charge them like $120, $150. Okay. The troches and nasal sprays. The big pharma came out with a nasal spray. Here's hilarious. 80 milligram dose, which is kind of subtherapeutic for a nasal dose. Nasally and orally, it's absorbed 30%, 35%. So to match,
90 milligrams turns into 30 milligrams,
right? Which is enough for pain management, but not for PTSD, not for making a breakthrough. Yet they charge $800 for the dose.
Wow.
The manufacturer's cost to my pharmacy is $800. It's crazy.
That is crazy.
Meanwhile, I'll give you 30 doses of 100 milligrams for $80.
Right.
It's just a little different, but that's big pharma.
That's big pharma.
This medication is available at any compounding pharmacy. You can call me with more details, or call your local compounding pharmacy, chat with them. They can help you find a doctor to check out therapy. There's a ton of stuff. There's an organization called the American Society for Ketamine Practitioners, ASKP. They have a website. They have a plethora of good data on there. There are a number of YouTubes out there by both practitioners and patients. And literally, those are of equal value. To hear a patient's story, as long as it's under 5 minutes, some of these go on for too long. Like this talk. Some of the patient stories go on too long. And check it out. Safety and efficacy, and if we could throw SSRIs in the toilet and get them off the shelves, I would be happy.
Right, because it's getting down to the root cause.
Yeah, it's getting to the root cause.
Why are you having these negative thoughts? We have thousands upon millions of thoughts each and every day.
Yeah.
80% of those are negative.
Yeah. Negative begets negative.
What's going to be the outlook for the rest of the day if all these thoughts are negative? So we can shift that balance, right? Yeah. There's always going to be something that's going to happen. It's not how we respond to it.
Yeah. We have 2 clinics in town I love a lot. The Austin Ketamine Clinic. The other one is Dr. Turnipseed's clinic, Roots Behavior. They actually do group therapies, and they start teaching meditation. They start talking about, hey, let's direct our thoughts. When we start going into the dark world, say, we're not going there. Snap our fingers, do something, distract ourselves. Because when we go there, we'll just keep adding fuel to it and make it bigger and uglier. I've got a Dr. Holcomb in town who does a wonderful group therapy with low dose, with ketamine troches, 2 to 4 people. He is not doing any IV or IM. He's really been really happy just doing bucals in office. You get a prescription, you go over there, and he does therapy. And half are insurance and half are not. He has two different programs going. I like him a lot. We've got 4 IV clinics in town that are all doing well. In Austin, Texas, ourselves. Good God, that across the nation, there are thousands.
So if someone's not in Austin, where would they go find someone who's doing ketamine therapy? Where would they?
I would call a compounding pharmacy in your neighborhood. Check your zip code. Put compounding pharmacy in your town.
Got it.
Call them and say, hey, are you making ketamine, nasal, troches, suppositories? And they'll say yes or no. And if they're doing it, they could probably refer you and give you a good backstory on the docs in their town and give you an idea of who they like, because we have the joy of getting to know all the doctors that do this. We really get to know them, their patients. Every patient that comes to my pharmacy, we go and sit and chat for about 15 minutes because I want them to know that they've got to give up control for 30 minutes if they want to work. They have to do it.
Sure.
If they were going to hang on white knuckling, you'll defeat the medication because it's not that strong. It's not like some of the other medications, the opiates and other things out there. This one, you have to give it permission. to really work. And it's about giving up control. And I don't know about you, for me, giving up control was a bear, and I had to get talked through it. But now I share that with my patients, that is 30 minutes, you can have all the control back. You get the keys back in about 30, 40 minutes.
Sure.
It's all yours. So,
but you have to meet criteria, right? So you have to go to a doctor.
Yes.
Of course.
Yes.
The doctor's probably going to give you a scale, maybe a Beck scale.
Beck scale, and there's a number of different other ones. Clinical history. If you show up and you've been on an SSRI or any of the stronger ones, that's pretty much validates you need this.
SSRI or SSNRI.
Yes, SSNRI. The whole family.
The whole family.
The whole families.
So not everyone's a candidate. You have to go to the doctor, meet the criteria. Then if they are a candidate.
The only candidates they're not wanting to see are people who are brittly schizophrenic.
Got it.
And there's very few of that. They get managed even on their medications, and then there are doctors who will even work at that clientele because it's working so well.
Wow. Okay.
Now let's talk about one of the nutritionals and what we can do to supplement to make it work better. In addition to the ketamine. Again, I use products that will support the dopamine system and the serotonin systems. Those are our two calming. And when we're under a lot of stress, those two hormones get trashed. We chew them up. Very fast. And so I want to give a lot of precursors. I want to give a lot of the supporting vitamins that help me make it better and faster. And
so what are those?
Oh, there's a ton of brands.
I
like using combination brands and that have 6 or 8 ingredients. The things would be L-tryptophan, 5-HTP, DL-phenylalanine, tyrosine, N-acetylcysteine, vitamin C, B6, B12, zinc, magnesium. All of those help me to make my own serotonin, help me to make my own dopamine. Other nutritional supplement I love a lot is called l-theanine.
I know you love your l-theanine.
Oh my God, I love l-theanine. Every ADD and bipolar kid in this pharmacy gets it. I give them capsules, and I also have an oral spray I love, and that is. I tell 2 stories on theanine. Theanine blocks the glutamate receptor and ties it up, cuts down the anxiety that you get. Say if you go to a really crappy Chinese restaurant and they put in MSG.
Sure.
And you all get that flush feeling, and you all get your skin crawling, and you kind of fingers tighten up. From the glutamate. And that lasts MSG. Right, so 20 minutes, you feel like this ain't right. Some people have much bigger reactions. I just get flushed. It'll block that. If you were eating some bad Chinese food and you feel that, you could take a whole bunch of theanine and it'll get it down in about 5 minutes.
So if you eat on accident, right? You go to eat some bad food, but every once in a while stuff happens.
Happens, and if you have your bottle with you, like I always do, you spray a bunch in your mouth and it blocks it. You have to use a liquid for this because you want
that'd be good for acute stress, right?
Acute stress.
If you're in traffic, downtown Austin, or downtown wherever you live.
I talk about driving down Mopac to work, and I like being on the inside lane and passing everybody. And some mornings, policeman gets behind me and I get nervous and I slow down the speed limit. And I am like, oh, he's going to run my license plate. Oh, blah, 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 blah. I'll grab my theanine bottle out of my backpack, spray it in my mouth. And 2 minutes later, he's out. He's pulled away from me. He's left me. And I love that effect. It's just all the anxiety just goes away.
And it's just brainwaves too, because there's beta brainwaves, which we're probably in right now in a conversation. Yeah. But if we get too anxious, too excited, those get stimulated. So more the alpha, which theanine does, is more the meditative, more calming type state. And so if we can take theanine, we're going to shift our brain states, to more the healing, more the parasympathetic mode versus the acute sympathetic overdrive.
And our body is one giant biochemical reaction. Our brain is just a bunch of hormones bouncing around energy, around electricity. And the more I can bring calming in, the better I'm here, better I do. One of the other wonderful things that we've been using with our ketamine patients is a product called oxytocin. Okay. And it is a prescription med. It's used in birthing. Moms in their last trimester make 1,600 units of this every single day. It brings them that sense of you can see when a pregnant woman's walking down the street, you just see that glow. They're like, nothing's messing with them. nothing. No, the house would burn down. As long as the kids got out, the dogs got out, they're good. We use a lot of that for autism in low doses. We use a lot of that for females for rebonding with their partners. We use it for guys to bond with their partner and to not leave after they're having sex and go get a cigarette. It just is the oxytocin is what we call the bonding hormone.
So it's what you get when you give someone a hug.
Right. We get a hug, which we're damn it can't do in COVID time.
Right.
We're
6 feet.
yeah, the 6 feet rule. We're doing it right here. We're using metric system. The oxytocin, we use a lot of that for patients that get infusions that are in the office. It helps them to trust their practitioner more, and that's become popular.
So people who have trust issues.
Yeah, big on trust issues. Really good.
Yeah, they just have a really hard time really getting to know you,
Yeah.
accepting you into their circle.
Yeah.
So,
and what real common in some of our offices is have had some turnover with COVID. They've had new staff and patient who's been doing therapy, and now they're new practitioners with them. They're like, oh no! So they get a little oxytocin, and their diaphragm drops, their foot drops, and they're calmer. And it came from a very small study in India some 12 years ago with 60 autistic children. They were given 100 units, and then instead of playing with an inanimate object, they switched and started looking at their mothers.
Wow, that might be a trust issue as well.
Yeah. So these children.
So cool.
So behind that little study, their moms started taking it, and they like their husbands again. So, and then that's
why my wife takes it. Now.
Right. Same here. She tolerates me much better when she takes a little bit of it. What else would you want to talk about?
There is so much to talk about, but I think what you're doing is amazing. Maybe a lot of clinics aren't doing this. They're not getting the comprehensive approach. They might be looking at ketamine because the treatments they were getting before weren't working. The medications, they weren't working. So then they're coming to someone like you, in addition to the doctor, and they're saying, hey, I want to take ketamine. What else can I do? What else can I do to get to the root cause? You kind of mentioned the compounding that you do. So you compound oxytocin with theanine, with ketamine.
Yes.
But you also get down to some vitamins, some nutraceuticals, right? So what else can we do? What else can we do, Tommy? Hug her kids, hug her wife.
Hug the kids, hug the
get her sleep.
I'll bring up another area. We're all wrapped up in the whole opiate crisis that we created from the 90s. Thank you, Purdue Fredrickson. May you burn in hell. I guess we'll bleep that. But, and now they're making the rescue drug for the opiate addiction they created in the 90s, telling us practitioners.
What is the rescue drug?
The naltrexone and the naltrexone.
The low dose naltrexone.
No, the injectables naltrexone to recover. Okay. And the rescue drug for the high dose for the fentanyl and opiate overdoses on the streets. A number, and we're doing more monitoring, and the doctors are being pushed by the legal systems and the DEA to cut off patients that are taking high dose opiates. We have found using a small amount of ketamine at a 10-20 milligram dose amplifies the opiate and allows a patient to cut 20-35% off the opiate immediately.
Wow.
And that
different pathways.
Right. There are different pathways and synergistic. The ketamine has a pain blocking capacity. It blocks opiate receptors, not as well as the opiates, but it does tie them up, and pretty good studies showing it. And we've got about half our pain doctors in Austin over the last 6 months just now testing the water with it. And they're like amazed. And it's helping them make their reports back to the Fed saying, hey, we're lowering our usage. So we will see more and more of ketamine being used as microdosing 2-3 times a day for pain management. And that in a nasal spray or a troche either has been working very well. So,
that's awesome.
So if you're out there and you're having, in your arena and you're doing opiate for a car wreck, bad surgery, consider investigating microdosing the ketamine. That works. And also you mentioned low dose naltrexone. We're finding low dose naltrexone 0.5 milligram twice a day for our opiate patients has making the medication work better, and it's recovering the gut. It's blocking the mu receptors in the gut just enough so I can start pooping. And if I can get my gut emptying every day, every other day, the referred pain of blockage is coupled with a lot of opiate use.
We need to talk about low dose naltrexone next time for sure.
Oh, that'd be heavenly.
Yes. So, Tom, it's been amazing having you here. Just so everyone listening here, please let people know where they can find you. We have your website up top on the whiteboard. Let's Ask Tom. So that's for anyone around the country, right?
Anyone
to get supplement advice, nutrition advice.
Yes. Our pharmacy is Austin Compounding Pharmacy. We've been here at this location since 2012. Our previous location since 2005. I've been playing pharmacist for about 40 years now. I got out of school a long time ago in a faraway land of Houston, Texas. You can reach us through austincompounding.pharmacy, and you can reach me personally if you want to do a consult, carry on further at letsAskTom.com. Thanks. Good luck out there.
Yeah.
Wash your hands, damn it.
Wash your hands. Stay safe. And again, just a disclaimer, because we were talking about some medications here. This is for informational purposes only.
Yes.
Always ask your healthcare practitioner about medications and advice. We are giving no medical advice here. If you have any questions, please let me know in the comments. We're definitely going to have Tom on again to talk about some other drugs like low-dose naltrexone that are seeing amazing results, especially in the autoimmune population. So, Tom, thank you again.
Thank you, sir.
Yep. And
have fun.
Have a great day, guys. We'll talk to you soon.